I'm going to talk a little bit about cervical cancer screening. And cervical cancer screening was first discovered in 1929, so literally almost 100 years ago. And the way in which it was developed was to pull cells off the end of the woman's cervix and dye it and stain it and look at it under a microscope. And it worked. It worked at decreasing cervical cancer by 75%. And that was the way in which we did it then, 100 years ago. And now, in the 21st century, we have a different way of screening that is actually more accurate and better and offers you a way of screening without having to have that speculum. So I will, a little bit about who I am. I am a professor at the University of Michigan. I am in family medicine and also in obstetrics and gynecology. I have been trying to figure out how we can help women prevent cervical cancer for probably the last 30 years. I've worked on the HPV vaccines, and I'm also now working in trying to make screening something that people will want to do and can do easily. If you want to know any more about me, this is my information and where you can find me on the web, and I invite you to look and see what you want to find. I do have to tell you that I have a working relationship with Roche Diagnostics. Roche is a company that provides materials to the pathology lab to actually do the pathology tests, but they don't have anything to do with this study. The kinds of things that I hope to share with you and hope that you ask me questions about are three. The first one is how this virus, this human papilloma virus, actually causes cervical cancer. And then the second one is to show how primary HPV screening, so finding and trying to test for that human papilloma virus, how that is much better than the old pap test, or what we call cytology. And then the last one is to show you what the difference is in self-screening versus having the speculum exam. We can still move to HPV screening instead of pap testing, but that doesn't get away from the speculum. So what I'm offering you is an option to get away from the speculum and to do self-screening. So this is what human papillomavirus, that's how it's spelled. It's HPV is its abbreviation. In the upper right-hand corner, you see that little pink ball. It looks like a soccer ball. It has little triangles in it and looks like little flowers. It's a very small virus. It's a DNA virus. It's double-stranded, and it is it's insidious. It hides. Once it infects your skin, it hides from the human being, so that the human being doesn't know that they have it. It is the most common sexually transmitted infection. Unlike other sexually transmitted infections, it has to be skin-to-skin contact. It has nothing to do with fluids or liquids. You can't get it on the toilet. It has to be skin-to-skin contact. HPV causes nearly all the cases of cervical cancer. We know that this is one of the very few times when an infectious disease actually causes the cancer. That it's not genetic, it's not anything else. It is caused by a virus. But this virus also causes cancer in other places too. And those include the anus and the penis for the man. The vulva is kind of the outside of the woman. The vagina is inside of the woman. And then the throat cancers that Michael Douglas had, that you hear other people may have, the head and neck cancers, is almost all caused by HPV. Now, human papillomavirus is part of a big family of viruses. There's over 100 types. I call them cousins. 14 of those cousins are what we call high-risk type. They're the bad players. They're the players that cause the cancer. And those are the types, when we talk about testing for HPV, we're talking about testing for those 14 types of high-risk HPV. We know that globally, worldwide, cervical cancer is responsible for over 300,000 deaths of women in 2018. That's 250,000 women that die every year from cervical cancer around the world. This happens most often in countries where there is no screening available or no vaccination. But nonetheless, in the United States, we still have a significant number of people who are getting cervical cancer and dying from cervical cancer. This is a highly preventable and a treatable cancer, highly preventable, which is why I'm talking to you today, because it doesn't have to happen. Cervical cancer was once the leading cause of cancer deaths among women in the United States. The HPV vaccine and screening have made it the most preventable of all cancers. The CDC came out with saying that several years ago when we started to do the testing for HPV vaccines and looked at how well screening had been doing. If we know in the United States that there are like 200,000 people with precancers, they have real disease on their cervix, but it's not yet cancer. And of those, 11,000 go into cervical cancer. And of those 11,000 women, 4,000 women die. We have to think, well, what comes before that? What's leading to those cervical cancer precursors? And that answer is HPV infections. That answer is that a woman can get infected with HPV, and we'll talk at how it clears itself away, but she can get infected with it. And then if it stays around, it becomes a precancer and then can move to a cancer. And then hopefully we catch it, we detect it and treat it before it becomes something that she would die from. So is this common? Yes, this is common. The average lifetime probability of getting HPV is nearly 85% for women and over 90% for men. So yes, just about everybody will get this. Most of the infections will clear on their own, given enough time. 70% of them take a year to clear, and 90% of them clear within 3 years. This is very different than any other kind of viral infection that you get. If you get a viral diarrhea, that's usually gone in 2 or 3 days and your body's cleared of it. But with HPV, it takes a much longer time, because remember I said it was a sneaky virus. It kind of gets in the cells and hides there. But 90% of them go away within 3 years. 5% of them stay hidden and actually cause damage. Those 5% of infections, 5 out of every 100 women who have an infection can have disease progression. But that takes a long time. That takes between 15 and 20 years, which is why screening is so effective, because we can find it early for you. When we talk about preventing cervical cancer, there's 3 things. We talk about 1, 2, and 3, primary, secondary, and tertiary. So the first way that we can prevent cervical cancer is by vaccination. So if you can get your vaccinations, especially the young kids, 11 years old, 12, 13 years old, if they can get vaccinated, that's a really good thing. The secondary thing is screening, and that's what we're focusing on today. And the third way of preventing it is if you get cancer, you actually get treatment for it. So we're going to put this on a diagram and show you it on a graph. And what we're talking about is that that pink line is the age at which people get infected. So you can see there's a pretty big spike starting at the age of 15 years where HPV infection starts to go up. And it stays up until the woman's like 30 before it starts to go down some, but it never really goes down to 0. It takes about 15 years before that precancer, that purple line, starts. And then again, it's another 15 years before the cancer starts. So you see vaccination is pink. That's the first one, primary. The second one is purple, and that's the screening where we come in and screen. And that's what we're talking to you about today, is the screening part. And then the last one is we would treat you if there was something that we found that needed to be treated. So there are 2 organizations I want to make you aware of. The first one, you'll see their logo in the upper right-hand portion of the slide, and it's the United States Preventive Services Task Force. And this is a group of physicians and scientists in lots of specialties that come together and look at the evidence. And we do this for every single thing that you see your primary care doctor for. And we look at the guidelines every 5 years and update them. So in 2018, we updated them to say for women between the ages of 30 and 65, primary HPV testing alone was the preferred method of screening. And if that test is negative, you are perfectly safe to be screened in another 5 years. You don't need to be doing anything else in the interim. If on the other hand, you want to continue with the pap test, the first test we've had for cervical cancer, you can do that, but you would want to do that at every 3 years because that test isn't quite as good and doesn't give you as much reassurance. So the other organization that provided guidance is the American Cancer Society. And the American Cancer Society just came out a couple of months ago stating that for women between the ages of 25 and 65 years of age, they should be screened with primary HPV testing. And that, again, if it's negative, it should be at 5 years. Now, the reason they came out and said 25 to 65 years, whereas the other group said 30 to 65 years, is because, first of all, it's 2 years later, and we have more data that the younger girls, if they're vaccinated, they're protected until they're 25 years. And then after that, we don't have evidence of how much longer the vaccine protects them. So that vaccine gives them protection over that first time when they're most at risk for getting HPV infections, and then the women start into screening at 25 years of age. So I also want to talk a little bit about what the cervix is. When I talk to groups of women, go out and just chat about what is the cervix and ask women, what is your cervix and where is it? Most women are kind of like, I'm not really sure. And if someone has just had a baby, they'll say, weren't they telling me that my cervix had to dilate to 10 before I could push the baby out? It's like, yeah, that's absolutely right. That's exactly what it is. The cervix sits at the bottom of your uterus and keeps the baby inside until the baby's ready to come out. The cervix sits right here at the end of the uterus and at the end of the vaginal canal. So you see that the vagina collapses on itself. The vagina has two walls that rub against each other. The cervix moves up and down and up and down and back and forth as you walk. So the cervix is actually moving inside your body just as your intestines move. And you have the vaginal walls, which are close together and also touch each other. Outside of this, you have the outside of your body. Some people call it the lips, some people call it the labia, some people call it the vulva. People have all kinds of different names for it, but that is the outside of the body. And the way in which HPV infection happens is it has to come from skin to skin, which means that it has to affect this skin first and then go into the vagina. And once it's in the vagina, it can then go up into the cervix. So when we talk about screening and self-screening, we're talking about looking at HPV in this outside region and this vaginal region that's here. So this is the way, on the left side of the screen, this is the way you've normally had your pap test. You normally go into your doctor's office, you sit up on the table, they put on gloves, you have this metal speculum goes inside of you, and then they go in between there with that, that little spatula and take cells from your cervix. What we're showing you today is that primary HPV testing is the test of the future, and we are getting your ideas and your impressions of which method you would like best to do it, either a vaginal method or a urine method. Our study uses this blue device, and I'll show you that at the end so you can see what it looks like, as well as the urine device. And we'll show you exactly how that works and how the pieces go together. But this is what we're concentrating on, the right-hand side of the slide, the self-collected samples. This is a slide that's busy, that's full of a lot of data, and the only purpose of putting this here is to tell you and assure you that the self-collection of HPV testing is just as accurate as the clinicians. It is identical to the clinician. And to provide context, if I show you this blue balloon, this 50% is the sensitivity of the pap test. So it shows you that the regular pap test isn't as good as HPV testing is in finding cancer precursors, which is why you have to have it more frequently. Because if we do it more frequently, every 3 years instead of every 5 years, then we will be able to pick up changes that have happened. Okay, so this is old school. This is you up on a table, your legs spread apart. You have your feet in those stirrups. You then have the doctor puts on gloves, puts that speculum inside and pushes that vagina apart. And then once that vagina is pushed apart, they take that brush, go down the middle of it, and then the brush takes the end of the cervix and takes cells off of it. They turn it around and around a little bit and they pull it back out. So this is what has been history. This is what your moms did, your grandmoms did. This is the old way of doing it. What we are showing you, oh, how did that happen? Okay, what we're showing you is primary HPV testing. And what that says is that you don't need to be laying on the table. And we don't need to put a speculum inside of you. And we don't need to put that brush at your cervix. And we don't need to have that kind of test done. So instead, what we're testing is the vaginal walls and the outside skin that is collecting the HPV before it actually gets to the cervix. So this is a different way of looking at it. The blue circle is at the end of your cervix where the doctor would take the cells. This is your self sample, which you take from the vagina, or when you pee, what happens is your urine comes out and it's kind of like a garden hose and it just sprays off all the cells that are ready to fall off from the outside and from the opening of the vagina, and that's collected and we look at those cells. Those cells are very valuable. So this is what our project is about. We're self-screening for cervical cancer using HPV testing. Our study is not looking at comparing the old method with the new method. We already know it works. So that's what we're not doing that. What we are doing is this research to document whether or not you think this is a method that works for you. We are trying to see, do you like this method? And do you prefer using the vaginal swab versus using the urine collection? Which one is easier for you? Which one makes more sense for you to do? So this entire study is done at your home. You do it at your home. We talk to you over the telephone and we mail you kits, and our research assistants will talk to you over the phone on your questionnaires afterwards. You do the testing at home and you mail it back to us in a box that already has postage on it. So there's no cost to you in doing that. This helps us gather data about how well you appreciate or don't appreciate self-sampling. And it helps build a relationship with our community in letting you know that we care about your health. And in particular, I care about making sure that people are screened for cervical cancer. So this is what we have. This blue box down here with this blue instrument is the vaginal self-swab. It's called Her swab. It's not to be used when you're bleeding. So if you're having bleeding, just wait a couple of days and do it later. And if there's a little bit of old blood that's up inside, that won't matter. That will be okay, but just not actively bleeding. You'll see in the other little box that these are other kits that have been developed for self-sampling that they use in other parts of the world. The Evelyn brush is used in Europe, and the Dacron swab and the Vibra brush are used in other parts of Asia. But we have chosen to use the blue one because we think that it is more comfortable for women to use and it is easier for women to use. These are the instructions. They come with the kit. So you will be able to see them and read them at your own pace, in your own room, in your own bathroom. And what you see is that you can use it when you stand up, or you can be using it when you sit down. You put it inside your vagina just like you would a tampon. And you put the white part in. You see that little white part of the instrument here. That goes inside the vagina. And then the blue part, you turn it around, and when you're done, the little pink part will come out. That will be inside your vagina, which will have gathered your cells. You pull that straight out, and then once it's out of your body, you re-screw it so that the little pink thing goes back inside the white sleeve, and then the whole thing goes in a plastic bag and gets mailed back to us. So for urine does something slightly different. Everyone is used to going to the doctor's office and being told to go in and do a clean catch. And they have instructions on the wall that says, use these swabs and wipe yourself down before you go to the bathroom, and then pee a little bit, and then put the cup under and collect that, and then put it aside. That's not what we want. We don't want you to do that. We want those very first cells that are on the outside that you don't clean off, that will come in. So we want the very first 20 cc's, the very first quarter cup of pee that you have. And that will actually go into this little tube directly from the funnel that's here. I'll show you the instructions. These will also come in the kit. It comes as two parts. So you have a tube and then you have this funnel. So the first thing you do is unscrew the top. I'm going to show you something else. So at the bottom of this tube is a bunch of fluid. And we want that fluid in there because it acts as a preservative. So when it comes, don't dump it out. Just leave it in there and take the cap off that tube and take the tube and screw it into the funnel so that they're all connected as one piece. Okay, so this part, whoa, go back. This part gets screwed in to here, and that allows you to put this up to your body to start peeing. The pee goes directly into the tube, and then the rest of the pee comes out the back side of it. So if you look at the pictures, after you've got the tube screwed onto the funnel, you go to the toilet and you can either sit forward or sit backward. Some people prefer to stand, whichever is comfortable or works for you, and you pee. And the first pee will go right into the tube and stop, and then the rest of it just goes on out. And so you don't have to worry about getting your hands dirty or messy. When you're finished peeing, you pull the whole thing out from between your legs, and you unscrew the tube and you put the little green cap back on it. And then you put that in a plastic bag and you mail it to us. And that's all there is to it. So we have been doing this in a couple of different populations. We've been doing it in rural women in the middle of Michigan. Rural women often don't have access to a doctor, or they only have a male doctor and they're not comfortable with that person, or for some reason they don't feel comfortable with whoever is there doing the pelvic exams. So they don't get screened, and that leads to the cervical cancers. So we have been working with a group in rural Michigan, and they provided us feedback. And I wanted to share that with you, both to tell you that you're not the first group. There are others who have done this before you. You are our first African-American group that we're working with, but that the experiences that others have told us about have been positive. And so I just want to read some of these comments to you. One woman said, "It is an easy screening that you can do at home in your bathroom. You don't even make an appointment. It's unintrusive and easy. You just put it in the mail and you get your results. And it's good to get screened, you know, to catch it early is a good thing." And another lady said, "I would pick that any day over going to the doctor." Another one said, "I think they were awesome, and I hope it becomes an option for women to do it that way. I think you would have a big response and a lot more women getting screened and maybe stopping and preventing cancer." And another woman said, "I am not going to make a doctor's appointment unless I'm sick. And usually then it's not time to do a pap smear when you're sick. And this was perfect for me, totally doable, because going to the doctor's office, I don't like doing that. It's not convenient." Another woman said, "If I had one of these kits, I wouldn't mind doing it, getting screened like you're supposed to. I have not gone to the doctor since I had my last child. I would actually get it done." And another lady said, "I have 4 daughters altogether. You've got 5 votes from us." So I just want to share that we have a lot of positive response for people who have participated in our study, and no negative responses. I also want to share with you that this is real, that this addressing a last mile problem in cervical cancer screening is real money that the National Cancer Institute has put towards developing a trial that will provide the data for the FDA to approve self-sampling for HPV screening as a cervical cancer screening test. We are in process of talking with them, and they are looking for sites such as us where we know that we can reach out and we can have collaborations with communities that may not have been screened in the past to prove to the FDA that this works in the United States. And so we would very much like to partner with you in the future on this kind of national test that will forever change the way in which women get screened for cervical cancer. So just as a summary, what do you have to do if you wanted to participate in this study? Let us know. We'll give you phone numbers or an email address. Let us know. Call us. And we will do a screening. Our research assistants are Christelle and Elizabeth, and that you will be talking to one of them. And if you meet all the criteria and decide you do want to do it, they will mail you a kit the next day. You'll come in a box. That box will have a consent form in it. It will have all of the kits in it. It will have instructions in it. It will have the baggies that you need to put the collection kits in to mail back to us. And then you just have to use them at home at a time that's convenient for you. Put them back in the box and have the mailman pick it up. There's no cost to you. As soon as we receive it, which will be 2 to 4 days usually after we receive the package back from you, we will call you and do the phone interview about your experiences. And then the next day, we'll put $50 cash in an envelope with a letter so that you will receive that hopefully a day later. We will mail you your results of your HPV test as soon as our laboratory can do them. Because of COVID, we've had delays in getting those results to you, so it may be up to 3 months, but we've been talking to our laboratory person and she's working hard to try to get them to you as fast as we can. But I cannot promise you those in a fast manner, but we will get them to you as soon as we can.